Welcome to part 2 of our videos on hypertension. So in this video I'm going to summarize the concept of blood pressure and its determinants. So I'm going to use a simple equation which is BP, which is blood pressure, is equal to cardiac output times total peripheral resistance. What does this say? So the relationship between blood pressure and cardiac output is direct proportional, and also that of the total peripheral resistance, mathematically speaking. Then we also know that the cardiac output is equal to the heart rate multiplied by the stroke volume. This brings us to the third equation, which is BP is equal to open brackets heart rate times stroke volume closed brackets multiplied by the total peripheral resistance. So what does this say? So this equation says blood pressure rises when the heart rate and the stroke volume increases, or the blood vessels constrict, which is the total peripheral resistance. So it tells us about the relationship of blood pressure with all these parameters. So in mathematics we have direct proportionality, which is, so we can say BP is direct proportional to the cardiac output and the total peripheral resistance, and it is also direct proportional to the heart rate and the stroke volume. So what does this say? So when you increase the cardiac output, the BP increases as well. Or when you increase the total peripheral resistance, the BP in turn increases. So meaning we need to understand these parameters that are affecting our blood pressure. So let's start with the cardiac output. What is the cardiac output? The cardiac output is the amount of blood that the heart pumps per minute, which is described as heart rate times stroke volume. So what are the things that can increase the cardiac output? The amount of blood that the heart is pumping out. So we need to understand things that affect the stroke volume and heart rate. First, we'll talk about the heart rate. What things influence the heart rate? What things are going to increase the heart rate? So when you have sympathetic stimulation, think of it as when a dog chases you, that is a sympathetic stimulation. You are more like stressed, there's increased anxiety. Or let's say you have pain. Pain also increases your sympathetic outflow. Exercise, fever, hyperthyroidism, caffeine intake, nicotine, or anemia or pregnancy, these are hyperdynamic states. These increase the heart rate, how fast the heart is pumping. So whatever increases the heart rate increases the cardiac output, and in turn increases the blood pressure. Then we go to the stroke volume. What things increase the stroke volume? So there is a concept in medicine known as the Frank-Starling law. So this law says that whatever you give the heart gives back. So what we give the heart is called the preload, and this preload is the one that determines the stroke volume, which is the blood that the heart pumps out. So what determines this preload? So this preload is determined by increased salt intake, for example. As we know, it's a popular concept in physiology where we say wherever salt goes, water follows. And this increase in salt intake increases the intravascular volume, which then increases the venous return, and the venous return in return increases the preload, which is the amount of blood in the ventricles at the end of what? Diastole, which is the end diastolic volume. And that amount of blood that is in the ventricle is what is going to be pumped out and is what we're going to call the what? The stroke volume. So if you have increased intravascular volume, which is as a result of increased salt intake, that will increase the preload and it will increase the stroke volume, which will then increase the cardiac output. And if the cardiac output is increased, you know there's a direct proportionality between the cardiac output and the blood pressure, and that will further increase the blood pressure. And I'm sure most of you now understand why we restrict salt, a lot of salt intake, and also just salt in hypertensive patients. Then we can also talk about the total peripheral resistance. This is just how resistant or how tight or narrow the blood vessels are, and what can increase this tightness. So we can have vasoconstriction. So this vasoconstriction can be caused by angiotensin II, and also we can have atherosclerosis, where you have the vessels being hardened and thus they become narrow, and that increases the afterload, which is the amount of force that the heart has to pump against. So this also increases the total peripheral resistance and thus increases the blood pressure. So you can see how this equation sums up the concept of blood pressure, because it also brings in the risk factors and the causes of blood pressure just by understanding how they happen. So let me give just a simple example of how we can manage blood pressure just using this equation. So as we said, if you increase the total peripheral resistance, the BP increases. And one of the things that increase the total peripheral resistance, we said, is angiotensin II. So when you come to the management of hypertension, we give angiotensin receptor blockers or ACE inhibitors. So what these drugs are doing is they are just inhibiting the production of this or the action of this angiotensin II, which leads to increasing the total peripheral resistance, which increases the blood pressure. So if you stop this action, the BP decreases. So that's why we give angiotensin receptor blockers. Then when you look at the cardiac output we said was being determined by the stroke volume. And the stroke volume, we said the increased preload can also cause BP. So what drugs are you going to give? You're going to give diuretics. And what do diuretics do? They take out the fluid from the blood, so thereby decreasing the blood pressure. So this is how you manage blood pressure using this same concept of just blood pressure is equal to cardiac output times total peripheral resistance. But this is just an introduction. We'll talk about that in full details as we continue looking at hypertension. So this was just a brief summary of hypertension. In the next videos, I'll be talking about how blood pressure is regulated physiologically by the body, and then now we'll look at hypertension now as a condition and how to manage it. Thank you very much. I look forward to the next video.